Hello, my name's Eric Bates. I'm a professor of internal medicine at the University of Michigan and deputy editor of the Journal of American Cardiology Case Reports. We've had podcasts of interest on topics reflecting manuscript submissions that we get to our journal, and we've had great interest in the relatively new field of sports cardiology today. So we thought we would do a podcast on sports cardiology to help amplify the possibilities of using that new resource in cardiovascular medicine. So let me first introduce our physician guests. Matthew Martinez is director of the Atlantic Health System Sports Cardiology Clinic in Morristown, New Jersey, and former chair of the ACC Sports and Exercise Cardiology Council, if I said that mouthful correctly. And Mustafa Husaini is also a sports cardiology who's just started that program at Washington University in St. Louis, Missouri. So we have two experts on sports cardiology. I am not an expert, so this will be instructive for me as well. Most importantly, our special guest is Priscilla Frederick, now known as Priscilla Frederick Loomis, an elite athlete who represented Antigua and Barbuda in the 2015 World Championships for track and field, and in the 2016 Rio Olympics in track and field. Her event is the high jump. And the first thing I want to do is ask you why the high jump and what kept you going for almost 20 years, including 10 years after you graduated from college. What is different about an Olympic international athlete than us weekend warriors?
Well, hello. Thank you so much for having me. Can you guys hear me okay? Okay, great. Awesome. Thank you so much. I will say I never expected to be, on a podcast talking about cardiology. So this is definitely something very new for me, which I'm very excited about. But I always wanted my story to be like the heavens opened and sun was shining on the high jump, and it was just like a calling. But unfortunately, I started running track and field at 6 years old, and I was introduced to the high jump in high school, my freshman year, because one of the other girls needed a teammate to compete. And so my coach saw me and said, "You're tall, you're skinny, let's put you in this. Let's give it a try." So I said, "All right, how do I do it?" And if you guys remember, there used to be like flip books where the pictures would change and create motion. That's how I was taught how to high jump. He said, "This is what it's supposed to look like. Can you do this?" And I was like, "Yeah, sure. Why not? Let's see what happens." And so I cleared the opening bar, which meant my teammate could, which told my coach, "Yeah, she's going to be a high jumper." And so I really just kind of fell into it, but I kept getting better. It became really natural for me. Once the coach was like, "Hey, why don't you try lifting your knee a little higher? Why don't you try being a little bit more patient?" The heights kept coming. And my mom, sacrificed another part of her life and got me a private coach. And it just kind of snowballed into that. My career lasted so long. Honestly, I have no idea. I didn't want to do this at all. I wanted to be done after high school, retire, and go to school in New York City to be an actress. I wanted to be the next Beyonce. So nothing in my life even correlated with track and field. But as I got older and I moved forward, my mom said, "You can jump only for a certain amount of time, but you could act at any age. You could be the best grandmother on Disney Channel, but you can't always high jump," right? So I said, "All right, I'll use this as a way to propel my career, make a name for myself, and move forward." So it paid for college, and it got a lot more competitive, and it made me more competitive. I wanted to be the best that I could be. I didn't really care about, my competitors or anything. It didn't matter. Whenever I showed up to a meet, I said, "This is my time. all eyes are on me, everybody else can go home. So it gave me this element of entertainment, but it also gave me the sense of competition. And so I grew and I kept going, and the US didn't really support me after college. So I knew I had dual citizenship for Antigua and Barbuda and Dominican Republic, because my mom was born in Dominican Republic and my dad was born in Antigua. I looked at both programs and I realized that I didn't really know much about my Antiguan heritage. And this was an opportunity to get to know it and to really understand my culture and where I come from. And so I joined in 2014. I got my dual citizenship, and it kind of snowballed from there. And
So let me interrupt.
yeah,
You become an elite athlete.
yes,
You get the thrill of competing in the world championships and the
yes,
Olympic games in track
yes.
and field. And it's 2016. You could have retired. I've known Olympic athletes. You've written the first line of your obituary, I tease my friends. Why
Yeah.
did you keep going?
Because why would you stop when you're the 1% of the world?
Okay, well, you're hundredth of a percent.
Yeah. Yeah. You know what I mean? Like, why would I stop? If I still
Okay,
had it in me, why
yeah.
not? I was healthy.
So you train for 4 years. You're ready to go to the Tokyo Olympics, and
2020.
they cancel it because of COVID.
Yes, they postpone it right before World Championships.
You're
indoor.
ready.
Yeah.
You're all set to go. You're in the best shape of your life.
Yeah.
The premier event of your 20-year career, and they cancel it.
Yes.
So you retrench. You go 6 more months of training, getting ready for the 2021 delayed Olympics.
Yeah.
And what happens to you when you get sick?
I was ready to open up my season and for the indoor season of 2021. And I moved back home with my husband and trained for about a week, and I got COVID.
How do you know?
And
What did you feel?
I felt the worst I've ever felt. It was like a cold with the flu mixed in together with being punched in the face. So
Headache,
I had headaches. I
fever,
had chest pains. I didn't have a fever. Nope, didn't have a fever.
loss of smell, loss of taste.
Yep, all gone. And that was the indicator when I couldn't smell.
Could you climb a flight of steps?
No, I did not. I couldn't smell. I tried, and I love food. So I couldn't smell, and I was like, what's happening? And I had no energy. I legitimately couldn't drive up the street without being like, man, kind of exhausted.
So what was your first medical contact? What did you do to get evaluated?
I went to urgent care.
And what they
say? So they said, you have COVID, you need to stay home. So I stayed home and followed the protocol during that time, which was the 14 days since you started your symptoms. So
and you had your vaccinations, and did you have your boosters? And
I didn't have my booster, but I had been vaccinated. Yeah, I had the J&J.
Like most athletes, you're wearing the mask, you're doing everything you can to avoid COVID.
Yeah.
You've closed down the rest of your life, and you still get COVID.
Yep. But I mean, I was still trying to train.
Medicine, or did they give you any medicine? They just tell you to isolate?
No, they just told me to go home and, wait it out.
So what's the next step? 2 weeks later, you still don't feel well?
Yes. And I almost passed out in the shower, still no energy. It really just ran me over like a Mack truck. So I kept on having the chest pain. So I went back to urgent care. They did an EKG. And they said, everything comes back fine, but because it's your heart, we don't really know. Maybe we're missing something. You need to go to the hospital. It was National Pizza Day. So I was super upset. I couldn't get my pizza. And so I went to the ER. Nobody can come with you because it's COVID. So I went by myself. 6 hours in, they ran the EKG. They ran, all the tests that you possibly can. Again, everyone listening knows exactly what tests. I know the EKG. They ran some kind of blood work, and I was like, I don't know. They wanted to put me on an IV, and I was like, please don't. Like, it's unnecessary. So everything came back negative.
And you went home.
They said, you need to follow up with a specialist, and I went home.
Okay. And then, so who was your specialist?
So I went with my mom's. And so
a cardiologist or to a primary care doctor? It
was a cardiologist that she has used in the past. And so
what was the recommendation?
The recommendation was, we can fit you in for an appointment in a month. And
That's pretty fast in my place.
I was like, you guys got to be kidding me. Like, I was like, I have an emergency. I have a deadline. I have the Olympics. I'm having chest pain. Help me. So he squeezed me in, and I went to the appointment, and he was like, what are you feeling? What are your symptoms? How long has this been going on? And he ran another EKG. The EKG was fine. He said, all right, we're going to have to do a stress test, but, eventually we're going to have to get you to an MRI. Like, we got to figure this out, but I want to do more tests. And so then I said, okay, but I wanted a second opinion. That's always it, right? You get a second opinion. I said, this is one person. Let me go to another, cardiologist in the area that is well known. And they all knew each other. So they all connected, and they were like, let me refer you to this person who does more sports. So I was referred to another doctor who did another EKG, came back fine. So they talked to each other and said, hey, let's do an
CMR, echo test or a
yeah.
CMR? Yeah.
Yeah. So echo. I said, I know you're laughing because you're like, how does she not know anything? Still to this day, right? This is why I'm an athlete. I jump over a book.
Did they think you had an infection of your heart?
They really didn't communicate what they thought it was. Everyone was like, Priscilla, you're an athlete. You're in the best shape of your life. You'll be fine. Like, everything should be fine. But then it kept on being like, one more test. And I was like, oh my gosh. So then the second doctor that I got that second opinion from, I met him only virtually, and he sent the heart monitor. So I wore my heart monitor for a week, and then I sent it back. Everything came back fine. But to me, I'm stressing more than anything I ever could, because the two things you don't mess with is your head and your heart, right? You don't mess with it as an athlete. You have to trust the experts.
Well, you also can't stop training.
No.
Because then you're in big trouble.
That was never.
Let me ask Mustafa to give us some background, because you both get patients like this. Just to cut to the chase, we're worried about myocarditis. So how do we make this definition of myocarditis? Because frankly, I looked up this, let me read it correctly, ACC expert consensus decision pathway on cardiovascular sequelae of COVID-19 in adults myocarditis. And I read it, and I'm still not 100% sure how to make the diagnosis of myocarditis. Can you help us out? If she comes to your office, rule out myocarditis, what are you doing?
Yeah, so just want to say first off, Priscilla, your story is amazing, and I'm so glad you're here to talk to us.
Thank you.
Back to the question at hand. So myocarditis, as we know, is inflammation of the heart muscle. Classically, we used to think we had to do a biopsy to show some myocardial necrosis. Clinically now, we don't do that in a lot of patients because most people are pretty low risk, and that's an invasive procedure. So we use kind of this clinically suspected myocarditis moniker, which is going to be a combination of clinical symptoms, so things like chest pain, shortness of breath, more fatigue, and that can be on a spectrum to heart failure and fulminant myocarditis. We also look for an elevation in cardiac biomarkers like cardiac troponins, and then imaging changes. So these are going to be EKG abnormalities. These are going to be echocardiogram abnormalities or abnormalities on a cardiac MRI. And as we'll probably talk about, we know that as our imaging gets better, quote unquote, we are finding things that are very sensitive, but that doesn't always equal disease. And so right now, the clinically suspected myocarditis should have clinical symptoms that are consistent with troponin elevations and imaging that are also consistent with that clinical story.
So you found your way to Matthew's office eventually.
Through a very long, weird journey, yes, I finally found him after they told me that I had to shut down my season and I was done. I would not go to the Olympics. My Olympic journey was done.
Okay. Matthew, she walks into your office. What are you doing?
So her story is not unusual in athletes. And remember, this has been an evolving story, and we're further into it now than we were at the time. But colleague of mine heard her on the radio telling her story that her career was over because of some diagnosis that she was unclear about, and said, I'm going to call in and I got a guy. So she came to see me, and we looked. Her ECG was very typical for an athlete. Her echo showed very typical echocardiographic features of an athlete.
Can I interrupt you? Can you describe her EKG and what you mean by an athletic EKG versus a weekend warrior EKG?
So she had sinus bradycardia. She had some repolarization changes. She had no evidence of hypertrophy or abnormal T-wave inversions. She had a sinus bradycardia low to mid 50s with typical repolarization changes, a little bit of increased voltage throughout the ventricle, but nothing exciting. Typical for an athlete. Her echocardiographic features showed a mildly dilated right ventricle, a mildly dilated left ventricle. Her wall thickness was normal. The function was normal for both sides. She had appropriate normal diastolic function. Her stroke volume on both her left and right side by echo were normal. Her troponin values were completely normal. In fact, it was a 0. I don't think I've seen a 0 troponin maybe in a decade, but not subtle, normal. So she came, and then she had an MRI. At that point, she had already had an MRI, which was really what I think was the challenge. So she had, again, all those normal features I mentioned on echo, all confirmed. She had no evidence of scar tissue, no late gadolinium enhancement, but she did have a funny signal, mildly sort of visually increased change in what we know as T2 signal or an edema signal. And that's what I think led her to the overabundant caution of, I think you have myocarditis, I think you got to shut down. Because we know myocarditis is a potential harmful for athletes and can lead to sudden death. So I think it was out of abundance of caution. When you hear her passion, her excitement, this is who she is, this is what she does, this is a big deal. And the Olympic athletes are even a bigger deal. As you mentioned, this is long preparation, years of focus and energy on a single entity. Hard for anyone to do that.
So, Priscilla, you've got this absolutely poetic quotation. When you're rocking on the tarmac, ready to approach the bar, you visualize yourself running into the sky.
Mm-hmm.
I love that.
Yes.
So before you come see the hero of the day, you're done.
Yes.
20 years, you got to be crushed.
No. Really? I'm a big believer, and in that year, especially 2021, my resolution was control what you can control. And I truly believe that. And so I can't get upset about something that I cannot control. This is something about my health, my longevity. Now, I did ask the other doctors if I could still compete, and I'll have oxygen in between jumps. Like, I'll do whatever. And I was willing to risk my life in order to make these Olympics. But then my husband had to sit me down and was just like, calm down. You have to really be realistic, right? And so for me, I had done everything I set out to do. I was retiring after this Olympics anyway, and everything happens for a reason. If I'm alive and I have a healthy heart, then so be it. But there's that one glimpse of hope, and that was Dr. Martinez, was that appointment. And going in there and having all of these technical terms that I didn't understand, and then they kind of were like, it could be fatal. Of course, I'm like, there's 1% hope. And that was him. So when he came in and said, wait, are you sure these are your MRIs? And I was like, yeah, it's my name on it. Like, what are you talking about? Yes. Who else am I bringing? He was like, I don't see anything.
How many weeks had you been off training?
3.
Okay, so that's actually pretty fast.
It's not, well, you're not supposed
training
to,
lost for an athlete.
yeah, you're not even supposed to miss 3 days in a row.
Yeah,
because once you miss 3 days, it's
So
it's
Matthew, talk about the decision on return to compete, return
So
to
at that
exercise.
So at that point, she was completely asymptomatic. She was having some atypical findings, right? Now that we've alerted her that she may have a heart condition, even little things that were never an issue for her before became big in her psyche. So we had to get through that. And so Priscilla has my cell phone number. She was able to text me and say, I was walking up the stairs and my heart skipped. What's that mean? Or I was running and I'm starting to get exercise. So we were able to, at that visit, we spent an hour. We went through the images, we went through all the stuff. Her mom was there. We had to really convince them she was safe. And then we came up with a nice return to play, a gradual return to exercise, really focusing on any symptom resolution. And then she did what all elite athletes said. She was like, sure, I'll do that. And 2 days later, she said, I'm full blast. I feel great. So that wasn't what we wanted her to
Wow.
do.
Okay.
But she, this is oxygen for her. She got after it. She went home and worked out that day. And then we were able to stay in constant communication over the next several months while she got herself back into shape. And as she said, I can't come to visit you again. I got to jump. She kept telling me today, I got to jump.
Mustafa, how about the athletes that are under the age of 21? You have to deal with their parents. Do you take a defibrillator to the athletic field? Do you put a monitor on them? How do you, say the patient had COVID, had myocarditis, what precautions do you need? Do they need to be off for 6 months? And they go back in 2 weeks with a defibrillator at the courtside?
So I think it goes back down to what we think the diagnosis is. And I think kind of goes back to what Matt was saying, is that if we think this is a true diagnosis of myocarditis, they have the clinical syndrome that's consistent, they have cardiac biomarkers that are elevated, they have imaging findings that are consistent with myocarditis, and not just something from increased specificity. I mean, the treatment right now is going to be restriction for 3 to 6 months to make sure there's not development of some arrhythmias. I think the question is, if we don't think this is a true diagnosis of myocarditis, that is the question where we have to have a discussion and explain this is why we think it's not the diagnosis, but we are never 100% certain. And that's when we kind of have our shared decision making, saying that it is always a good idea to make sure that there's an AED and an emergency action plan in the community, whether or not myocarditis is in the picture, because we know these things happen. And so making sure that that is always something that we always talk about, but also saying it's a very low risk and the diagnosis isn't consistent. And so I think it's just that reassurance that a lot of both patients and parents often need to make sure people can stay healthy and stay active.
So Priscilla, when you got the second opinion from Dr. Martinez, and you obviously took that one instead of the first opinions, did you have complete confidence in your safety and your health? Or did you
100%.
still have some nagging concern about your health?
There was no hesitation. There was nothing. I trusted him completely.
How long did it take to get back into peak training mode?
I went full force 24 hours later. I didn't have time to spare.
The total fatigue and the steamroller called COVID that ran over your body was about a 4-week illness or longer?
So what everyone kept on saying was that I have long COVID. So to this day, I still don't have my sense of smell back. I can't smell anything. So it's still lingering. I get a little bit of heartburn, what we're going to call it now, every so often. But for that first, at the time, I had like a month and a half to get ready and get qualified for the Olympics. So I was in that stage. They take top 32. And so I didn't care what I felt like. If I was exhausted, it didn't matter. I pushed through, I traveled, I did what I needed to do. And I was never 100% while in that month and a half, because it takes a while once you're out of that cycle, that routine. And so it was the last chance meet, and I was in the Bahamas, and I had actually won the meet, but I missed out on the Olympic Games by 4 spots. So
tell us what fraction of an inch that is.
About that much.
Yeah, thank you.
Yeah, about that much.
Those of you who don't know about the high jump, she clears over 6 feet 3 inches.
Yeah.
So she missed her second Olympics by a few millimeters.
Yeah. And
Yeah.
I look back at it and I get scared because I'm like, wow, if I would have met Dr. Martinez as soon as it happened, I would have made the games. And
So how
that's the
are you
kind of
now?
stuff.
You've retired
I am. I'm retired, living life.
and you have an amazing outlook on life. And we want to
Yes.
emphasize that if you like podcasts, you can listen to her podcast called In Our Time. And if you need a motivational speaker, you can see the talent she has. So if you're around New Jersey, give her a call.
Or
But you're
anywhere
doing
in the
okay.
country. Anywhere
And
in the
you're
country.
anywhere in the country, but you're doing
Yes.
okay in your post-athletic life because that
I
transition can be hard.
It is extremely difficult, but I was ready. I was ready and prepared for it. I knew that this was going to be my second Olympics. I knew that I was going to be done. And I knew that I wanted to give back to the next generation of athletes. And now that they have NIL, which is the name, image, likeness, I wanted to make sure that people were in the right hands and preparing for their careers now and their careers after. So now I speak on the Olympic mindset of courage, tenacity, getting incredible doctors with you and on your team at an early start. And I also talk about personal branding and, of course, NIL. So I am a motivational speaker because, again, you can control what you can control, but the best thing you can control is making sure that as an athlete, you're healthy from mental health to physical health. And I think the biggest thing is making sure that you're going to see sports doctors because that was the big thing that Dr. Martinez kept saying. Your heart looks normal for an athlete. But to somebody else, it was, no, you're not. You are not healthy, which was crazy
What
to
a
me.
perfect conclusion to a podcast that's much too short. So I encourage you to look up Priscilla Loomis on the Google search because she has an incredible life story. You can see why she would be a great motivational speaker for any type of gathering you have. So thank you very much for joining us.
Thank
Thank you to
you.
Matthew Martinez and to Mustafa Husaini for highlighting this increasingly important role of sports cardiology in the field of cardiovascular medicine. Thank you for participating.